Thank you very much. And indeed, this has been a year. And today we're going to walk through a little bit of what that year looked like in terms of the data that we have here in BC. I think to start, though, I will just update us on the numbers for today. We've had 569 new cases today, 3 of which were epidemiologically linked, bringing our total to 86,219 people in BC who have been diagnosed with COVID-19. That includes 140 people in the Vancouver Coastal Health Region, 301 people who live in the Fraser Health Region, 41 in the Vancouver Island Health Region, 26 people in Interior Health, 60 people in Northern Health, and a new case in somebody who normally lives outside of Canada. So we now have 4,912 active cases in the province, of whom 244 are in hospital and 68 are in intensive care or ICU. We have over 8,000 now, 900 people under active public health monitoring, and 79,000 people, 79,829 people who have recovered or are no longer infectious. And on this day that we remember everything that's happened over this past year, we've had 3 new deaths to report here in British Columbia, bringing our total to 1,397 people who have lost their lives due to COVID-19. And again, we remember, of course, the families who are mourning the loss of their loved ones during this difficult time. We have one outbreak that's been declared over at the Westside Care Residence, and now are down to 9 active outbreaks in long-term care assisted living and independent living, and 8 in acute care. I'm going to now go to our modeling presentation to give you an update of where we are in terms of the pandemic. And what we've talked about is really most of these data will show you a summary of where we have been in this past year. We know that our pandemic started before this date, but it is March 11th. That was the official declaration of a pandemic by the World Health Organization. This first slide tells us about the geographic distribution of our cases in British Columbia by health service delivery area, which is the broader health area. And as you can see, there has been no part of our province that has been spared from dealing with this virus. On the right-hand side, in the gray, shades of gray, is the last 7 days. And we see as well that while we have cases all over the province, some areas are dealing with a more difficult situation than others, particularly in the Fraser South area and now in the Northwest. Breaking that down by smaller local health area, we see again that there is no part of this province that has not been affected in the past year, and some more than others. And this gives us a much more detailed sense of our communities and the community impact in different areas of the province. And this shows what that impact has been in the last 7 days here in BC. And as we can see, there continues to be hotspots in areas of the province, and particularly right now around Prince Rupert, but also an ongoing challenge in areas in the Fraser Valley. This is a summary of our epidemiologic curves and our hospitalizations and deaths over the past year and a bit. Starting back in January of 2020, as we can see, our first wave was relatively small in terms of our numbers of cases. We had a high percentage of cases that were hospitalized, and again, this reflects the fact that early on we had limited access to testing. And the higher proportion of people, the more serious cases, were the ones that we detected early. We did have a bit of a reprieve during the spring and summer, which we all remember, of course. But the virus did not go away, and we saw it again resurge as we moved into the fall. We were grumbling along at a fairly low and controlled level, but when we got to the middle of October, we started to see rapidly increasing cases. And as the numbers of people being infected increased and spread exponentially, more people required hospitalizations, and sadly, more people have died. We've now seen that our peak was somewhere in early December. We've come down since then. We had a little bit of an upswing again after holiday season and over Christmas and New Year season, but we have been on a steady downward trajectory until about the middle of February. Since then, we started to climb up again, slowly and steadily, but we now are at a level that our 7-day rolling average has increased. But if we look at the statistics, what we see is that our hospitalizations has leveled out and come down, and really importantly, the number of people who are dying from COVID-19 has also decreased dramatically. So those curves are starting to separate. This is the same data presented by Health Authority, and this is by surveillance date, so we can see in the dotted line our rolling 7-day average, and it reflects again the fact that the majority of our cases and our concerns continue to be in the Fraser Health region and the Vancouver Coastal Health region, and in both of those areas we know are the most populated areas of the province. But we have seen increases and we've seen waves go through in every part of the province. When we look at this by what we call episode date, so that is by the date of onset of illness, that gives us a slightly different pattern, because the previous data that we talked about was the day that the lab test was done or the day it was reported. When we look back on when people were infected, we see a little bit more of a clustering and less pronounced peaks. This is to give us a sense of where we're seeing cases being connected to, and most of them still are related to clusters that we're seeing in our community. And we've shared some information about what these look like. Whether it's getting together at a small gathering for a wedding and inadvertently the virus being transmitted to others there, who then take it to their homes and their workplaces, their schools, their childcare centers. We know that this virus can spread underground before we notice sometimes that it is causing an outbreak. And part of that has to do with the age of people who are being affected. Early on in the pandemic, last March and April, we were mostly seeing older people being affected. And that is because we were monitoring in people who are more likely to end up in hospital. As we've progressed through the summer and into the fall, and again in the winter, what we're seeing it is that the transmission of the virus is being driven by two age groups of people primarily, and that is young people, 19 to 39, and also the age group from 40 to 59. So those are the two curves at the top. There are two scenarios where we're seeing transmission now. The most that transmission that we're seeing occurs when people are getting together, and even now in smaller gatherings, whether it's for social events, having a group together for a birthday party in one's home, meeting up with people in indoor environments, we know is the riskiest part. And the other part that we're seeing a lot of transmission events is in workplaces. And many of those workplaces are places where people cannot effectively separate on an ongoing basis, and the risk is higher. And some of those places we know are workplaces that we need to keep things going, like our food processing centers, like retail sorting centers. And we have been focused very much on our COVID safety plans in those settings. And when they're followed and when people are able to follow them consistently, we know they work. The positive news that we see in this is that the high rates that we were seeing in people over age 80 since October, November have now gradually come down, and largely that reflects the important protection that people are receiving in long-term care, assisted living, and as of the last few weeks, independent living, and our seniors and elders in our community. If we look at what the testing tells us over time and the percent positivity overall in BC, we saw high rates of testing early in the fall, and that continued through the winter months as the numbers of cases continued to increase in our communities. But it was not the same around the province. We know that in Fraser Health and Vancouver Coastal, where access to testing was ramped up and was quite available rapidly, we saw increases in transmission that reflected that. We've now come down and are hovering around 7 to 8% in both of those health authorities. Interior Health had several peaks and has now come down again. And we see the same pattern in Vancouver Island. Where we have more challenges are many communities around the north where testing is not always as easy to access, and where we have had to deploy some of the more rapid testing, and where we have seen connectivity between communities and people moving between communities and inadvertently bringing the virus with them. And that right now is reflected in what we're seeing in places like Prince Rupert. Overall, we continue to follow the impact of the pandemic on people by different age groups to try and understand who is most at risk. And this has remained consistent over the past year. We still are seeing relatively fewer cases than the population in young children, but we see more cases in people between 20 and 60, and an increase in people who require hospital care, ICU care, and sadly, a dramatic increase in people who are severely affected or die from COVID-19 over the age of 70. What is new about this data that we have today is that in the last few months we've also seen a number of people in their 30s who have died from COVID-19, and that is a tragedy that we now know can be prevented. We've also been following the impact of the pandemic on young people, and particularly the new syndrome, the multi-inflammatory syndrome in children, which has been identified as sometimes occurring after infection with COVID-19. We have had 10 cases confirmed in children in British Columbia among the over 10,000 children between the ages of 8 and 18 who have been affected. 7 required ICU admission, but all, thankfully, have recovered or are in stable condition, and we have had no children die. As we know, the majority of the cases were in the Fraser Health and Vancouver Coastal Health region, and that's where we see the majority of the MISC cases as well. One of the things that helps us understand the impact of a new virus or of a condition on our population is looking at its impact on overall deaths. And the number of deaths, or the mortality rate that we see, is relatively stable in a large population. On average, we have about 7,500 people who die every year in British Columbia, given our demographics and our age group, and that is relatively stable over time. Recently, StatsCan just put out some data around this measure for all of Canada, and it showed that in all of Canada for the year of 2020, so just from January 1st to December 31st of 2020, there was a 5% increase above expected numbers of people who've died in Canada. And that translates to about 14,000 extra deaths in the country. Many of those were related to COVID-19, primarily in Ontario and Quebec. We've also seen that data coming out of the United States shows that with the measures that they've had in place there and the impact of the pandemic, they had a 15% increase in all-cause mortality in people who died in that country during 2020. And that is the largest increase that they have had since the 1918 influenza pandemic. It is the third leading cause of death in the United States in 2020. When we look at British Columbia over the last 10 years, from 2009 to 2020, what we see is that the measures and the work that we did in British Columbia together to try and protect people from this virus meant that we have had a slight increase in people who've died, in our all-cause mortality in this province. But we have not seen a dramatic increase that has been seen in other parts of the country or in other countries. And we know that there are two things going on in BC right now. We have this COVID-19 pandemic, which has had impacts on some populations, and we have our overdose crises, which also contributes to excess mortality that we have seen in 2020. If we look at this in some more detail, for a virus that was not even known until we didn't have even cases until into February of, or late January of 2020, it now, for the entire year, COVID-19 was the eighth top cause of death in the province. And that may not seem like much, but it is an important marker that it is in the top reasons that people have been affected. And it tells us that this has had a profound effect on our population. The other thing that I will note, though, is number 5 on our all-cause top 15 causes of death in British Columbia is illicit drug toxicity. So again, the impact of the overdose crisis that we have in the province. And on the right is a measure of what we call potential years of life lost. So we know that some things affect younger people more than older people. And what we have seen is if we look at the potential years of life lost from COVID-19, that drops it as a cause of death to 11. What that tells us is we've just seen that COVID-19 has had a profound impact on older people in our communities, and the overdose deaths have had a profound effect on younger people in our communities. And the two of these are what we have had to deal with together here in British Columbia. If we compare, as we do periodically, our what has happened here, our pandemic here in British Columbia compared to other provinces in Canada, what we have seen is that we've had a low and steady rate. We have had an increase, as we know, in the fall and winter, but we've not seen some of the dramatic increases and decreases. And this is in the context of our plans and our ability to, as much as we can, keep as many things open as we can safely. And that means particularly schools, having recognized the impact that closing of schools had on families and children and educators in the spring last year. We've made it a priority. We've also made it a priority to open as many of those businesses that keep our communities functioning as we can safely. And that is reflected in the curve that we've had. Again, looking at the people who've died and our death rates in British Columbia compared to other provinces, we have tried and maintained a low and steady rate. And that, thankfully, is dropping off now. If we compare what happened in British Columbia, our pandemic, to some other countries, particularly ones that we know have been quite hard hit, like Italy, like the USA and the UK, we see again that we have quite low rates compared to international comparisons. And the same applies to the death rates that we've seen here, sadly, in British Columbia. Some of the things that we have been following more recently that concern us and we worry will have an impact on our pandemic for the next period of time are the variants of concern. And we have been watching these carefully. This is just a schematic to show you that our surveillance and our testing for these variants has changed as we've developed new tests that are able to be a marker or an indicator of who has one of these more concerning variants that are associated with increased transmissibility of the virus. So it is a change to this protein that makes it easier and therefore transmit more easily. What we had from the beginning was a three-pronged approach, doing some sampling, a random sampling of some of the viruses that were submitted in samples, targeting where we were seeing outbreaks or clusters to see if any of the variants of concern were involved, and then some of the targeted surveillance, for example, for people who have traveled. What we've now moved to is a more standardized surveillance where all of the tests that are done every day that are positive are then put through a screening test, and that's in the green on this example, the screening test to see if they have one of the variants of concern, the N501Y. That is one of the ones that's a marker. So right now, it takes about an extra day for the screening test to be done, and then after that, 3 to 5 days for the whole genome sequencing, so we know exactly which variant it is, or if it is a variant at all, because some of these turn out not to be. So when we report on a daily basis the number of variant cases, they're not in addition to the new cases that we report every day or in the 7-day average. What they are is a 2 to 3 day lag for the ones that we had reported a few days ago. And it is now being sped up so that we are able to detect more rapidly when we have a variant case. What we have seen with this surveillance that we've been doing is that we have seen an increase in the numbers of cases that turn out to be transmitted through our of concern. And the most common one that we have is the B117, which has been associated with the UK. And we're seeing it most commonly in the Fraser Health and the Vancouver coastal area, but particularly in Fraser Health. The second most common one is the B1351, which is the variant associated with South Africa, and we've seen small numbers of that, and not as many, certainly not increasing numbers over time. More recently, we did have one cluster with a new variant, the Brazil variant. It's marked as P1 on this. They were all associated with one group cluster in the Vancouver Coastal Health region, and we've not seen additional transmission from that group. So these are things we're watching very carefully. We need to understand what the impact is of these variants. We are following up as public health, making it a priority to understand the case and contact management of people who have these variants, because we have seen what has happened in other parts of the world when they start to take off. Right now, we are still in a very small percentage of our cases that are variants of concern, and what we are seeing is that with the same measures that we have in place to prevent transmission, including supporting close contacts to be able to effectively isolate, doing testing of close contacts to make sure that they aren't infected before they're released from quarantine, those measures are working. We're not seeing rapid takeoff of variant cases like we have seen reported today from Ontario, for example, where about 40% of the cases. We're still under 10%, but we are seeing that these are increasing, which tells us that every transmission in the community where these are moving on to others puts a little bit more risk into the scenarios that we have. So if you're somebody who's with a group of people and most people are only passing it on to one person, we know that if you have this variant, you may pass it on to more people more easily. But I do want to put this in a bit of perspective for us here in British Columbia. We are looking at a whole genome sequencing of the over 12,000 now variants or lineages that we see in British Columbia since the start of this pandemic. And we can see that this virus changes. And changes not as quickly as some other viruses, but it does change over time. And we have many different variants that are circulating here in BC. And if we focus really just on the two variants of concern that we've seen most often, they are still rare compared to other viruses that are circulating in our communities. And we know that the same measures that we need, that we have been doing, are effective against these ones as well. So that is important for us to pay attention to. We can't let these ones take hold. We need to pay attention to those situations where transmission is more common, and that's indoor settings, when we're close together with people, when we're not wearing our masks, when we're talking loudly. Those are the things that we need to continue to avoid so that we don't give this virus a chance to change. Finally, I want to talk a little bit about the light in our tunnel, and that is the vaccine, the fact that we have safe and effective vaccines and are now rolling them out on a population basis in BC. We've had over 300,000 doses being provided, and over 250,000 people have had the protection from a single dose. Though that protection takes time, it takes several weeks, but we know from the information from the vaccine studies, the vaccine effectiveness studies that we started at the very beginning when we had the first vaccine here in December. We made our research team at the BC CDC. It was important for us and continues to be important for us to monitor every single dose and make sure for safety reasons, but also so we can monitor the impact of the virus. And this work has allowed us to understand the protection that we get even in situations like long-term care homes with our most vulnerable of seniors and elders, that we can have excellent protection from a single dose. And that is what has supported us to be able to make that really important decision to extend the interval for second doses so that we can protect more people more quickly and win that race that we are in right now. So this is the data that helped us make those decisions. It shows very clearly that once 2 to 3 weeks have passed, we have a rapid drop-off in risk for people who have been immunized. And it was as high as 89% after 3 weeks. But we know as well that we need to continue to monitor this, and we will continue to ensure that we're watching to make sure the protection is lasting. This is the similar data presented slightly differently. It looks at people who are in long-term care on the right and healthcare workers on the left. And what we can see is within 2 weeks of immunization, we start to see a dramatic change in risk. So those are things that we will continue to monitor as more and more people are protected in the coming weeks. And I want to end off with looking at our models, because these are things that help us understand where we've been and the potential for where we might be in the future, particularly in the next few weeks. The next 2 weeks are what is going to give us a sense of where we are going to be come April. Right now, what we are seeing is a reflection of the activities that we did and the risks that we took or didn't take 2 weeks ago. And what we can see here in BC, that our reproductive number has been hovering along 1, but it's not the same everywhere in the province. And we know that we want it to drop below 1. And when we have concerns, variants of concern that are more transmissible, we need to get it even further below 1. And that is about the risky contacts that we have with others. So infectious contacts. So that's the time when you went with a small group of people and in your workplace and you took your masks off, or you had a coffee break together with others, or you had that other family into your home without taking those precautions. Those are the risky connections. If we do those with maintaining our distance, keeping our numbers small, wearing our masks when we can't maintain our distance, those are protected connections. Those are the connections that we need now. And what we see, of course, is that there's quite a lot of fluctuation with the smaller populations in the interior Vancouver Island and the north. All of those have started to come back towards 1 and under 1. Where our population is the greatest and where we have the most impact has been in the Fraser Health Region and Vancouver Coastal. And once again, we're trending back towards where we want to be, but we're not there yet. And the other models help us understand the risk and the situation that we're in right now. So what we can see is for interior, Vancouver Island and the north, we're trending nicely downwards. Where we have concerns, of course, is the potential for what could happen in Fraser Health and in Vancouver Coastal. And we know that's because that's where the higher numbers of cases are, but also the most population. So that is where we need to pay even more attention to making sure that our connections with each other, those needed connections that we have, are done in a safe way. And what this shows for BC is that much of what our future could be is driven by what happens in our populous areas in the Lower Mainland. And to end up, this is the scenarios that we could be looking at. So this is modeling, so this is not a prediction, but it is helps us understand the things that we need to do. Right now, the models show that we're somewhere around 50 to 60% of our normal infectious contact rates. In the past, when we know we can get it down to 40, 45, 50%, we can bend that curve back down. That's what we need to think about now. How can we do things to get us through this period of time as more and more people are protected from immunization, from these effective vaccines that we have? How can we do things safely now so that we're not having those potential transmission contacts in our communities right now? So to go back to our data then, as I mentioned, we have to date given over 360,000 doses of the COVID-19 vaccine. And that will be continuing as we have more vaccines arriving this week, as more people are eligible, and as we have our parallel track, of course, with the AstraZeneca Serum Institute of India vaccines that have arrived this week. Today's modeling shows us how this pandemic has progressed in our province over the past year. And what we have seen very clearly, that no one is immune. No community is immune to the virus or the impacts that have come with it. And the pandemic is still very much with us. The most effective tools we have had to control the spread of the virus have been our public health actions, combined with all of our individual efforts. We have made the biggest difference by our individual actions that give us collective safety. Things like washing our hands, staying home when we're sick, getting tested, giving others the space to stay safe, staying apart from our friends and family, and not gathering together, especially indoors, following our public health restrictions and orders. Essentially, it is essential, particularly when we're indoors, whether it's workplaces, whether it's visiting a shop, whether it's in our schools or in our homes. Our COVID safety plans work when we follow them. And we now have another very powerful means to push back on the virus, and that is our safe and effective vaccines. And with each day that more people are immunized, that level of protection for all of us goes up. We are progressing, but we're not yet in a place where any of us can let go of this progress that we've made, as much as we may want to. But what we can do is focus on those things that we can do safely. And right now, as the weather gets better, as we know we're heading into the period where the transmissibility will decrease, and we know we need that social connection, right now what we can do is safely move outside for some of those connections. As a result, and looking at where we are, the Provincial Health Officer Order on Gatherings and Events has been amended to allow for outdoor gatherings for up to 10 people. This means your children can have a play date with their friends over the March break, but with their same group of friends. And if they're in school, the group of friends that they're in a cohort with at school. You can meet friends outside and have a coffee, have a chat, have a connection, have a picnic in your park with your grandparents. Should you choose to meet with your family and friends, remember that those safety measures need to continue and need to be top of mind. We don't want to put people at risk right now when we know we have vaccines that will protect us in the very near future. So if you're seeing a grandparent and they've yet to be immunized, then continue to take those measures. Keep your distance. Do it outdoors. Wear a mask. I'd like to be clear, there are no changes to the current restrictions on indoor gatherings. Those are the things we need to pay most attention to. But there is an opportunity for us to stay together by staying apart when we're outside and to enjoy and take advantage of that. But no dinner parties. Don't ask your favorite restaurant to have a special event for you. Those are the types of situations where we've seen can lead to transmission that will undo all that we have accomplished. The restrictions that we have in bars and restaurants and pubs remain in effect. All of the restrictions that we need and we know work in our retail settings, in all of the businesses that are open, those we need to adhere to more than ever right now. And we must all continue to use our safety plans at work and school. This is slowly turning the dial. It's not flicking the switch. We know there are a couple of things that are happening in the next few weeks, and one of them is March break. And we encourage you to be a family, to go outside, to explore in your neighborhood. Next week as well, we have St. Patrick's Day coming up, and we know that for some people, that is a day where they like to gather together and have parties. And we know that alcohol sales can be a part of people losing inhibitions and perhaps forgetting their COVID safety plans. We have consulted with the food and beverage industry and had a number of conversations, and they as well are committed to keeping our communities safe and making sure that we don't have those temptations that put their staff and their businesses at risk. We all recognize that importance. And in the spirit of that, my existing order for food and liquor service establishments will be amended so that liquor sales for on-site and off-site consumption must cease between 8 p.m. on March 17th until 9 a.m. on March 18th. And there will be some caveats around full meal provision and how restaurants and bars can stay when they must close. And this was very similar to the restrictions that we put in place over New Year's. And that is really to protect our businesses and to protect the people who work in those businesses, as well as make sure that we don't have an explosive increase in cases related to an event. Right now, we need to save those parties for the summer, because that is what we're looking at right now. We get through this next period of time, and we can make sure that more and more people in our communities are protected. By the time we get to this summer, we will be in a different part of our post-pandemic world. Our recipe and our plan for the next few weeks is straightforward. We need to keep using our layers of protection, particularly in those environments where we know this virus spreads and takes advantage. If we can spend time with a maximum of 10 people, the same people, outside, but smaller continues to be better. And if you're going to see others, it has to be outside. We know, and I know where I come from, we have a saying that common suffering builds strong bonds. And I think all of us can relate to that over this past year. I certainly recognize and acknowledge that we've all experienced losses this past year. Some of them are an accumulation of tiny losses of those joys, those things that we had in our lives. And for some people, it's the tragic loss of a loved one, whether from COVID or whether from other things in this uncertain time. This unrelenting uncertainty that we have all been through together takes its toll, and I know that. Now is the time that we need to reach out again. We need to remember each other. We know that this has been hard, and particularly on our seniors and elders. Connect with them by staying apart and keeping them safe. Connect with the young people in your lives. They have had the least influence and the most impact. We see that in economic data, we see that in the school data, we see that in young people having challenges with jobs, having challenges with doing online university. Reach out to the young people in your life. Remember how important it is to hold them close. And I'll just stop it there. It's been a challenging year for us all, and now is the time again to remember to redouble our efforts, to remember to be kind to each other, because that is what makes a difference, and that is what will make us safe. Thank you.
Thank you very much, Dr. Henry, and thank you for all of your work over the past year, which represents so many people and so much dedication of a whole team of people in public health. And we, I think, are a grateful province for that contribution. So thank you very much. I wanted to start by acknowledging the 3 people who passed away related to COVID-19 in the last 24 hours. It is as we know, all of us know, an extraordinary and difficult time, and particularly when we're facing a loss of that magnitude. And so we want to acknowledge the passing of those 3 people and the 1,397 people who passed away from COVID-19 since the beginning of the pandemic. We are thinking of them today, particularly on this 1-year anniversary of many people, because they know an individual who's passed away, who has had a significant loss during COVID-19, are affected by this. But all of us, I think, have those people who've suffered this loss in their hearts. I wanted to note a couple of things about vaccines and immunization clinics, and just to bring you up to date on appointments that are booked. That number as of noon today was 49,761 across health authorities. That's 20,984 in Fraser Health, 7,889 in Interior Health, 7,583 in Vancouver Coastal Health, 7,583 in Vancouver Island Health, 9,691 in Vancouver Coastal Health, and 3,614 in the Northern Health Authority. I want to say that those numbers will be updated at the end of each day from now on, so we're not going to be consistently updating those numbers during the day, but at the end of each day so that people can see the progress that's being made. Today, as of noon, 10,598 appointments were booked on Thursday morning, and we expect today, needless to say, to be a record day. As you know, those aged 85 to 89, born in 1936 or before, as of noon, were able to start to book appointments, and they are doing so in significant numbers, and that's an important thing. There are 74,769 people in those categories, and so we are hopeful that all of those people, or as many as possible, can phone and book appointments in the next few days. I wanted to note, and this is more important than all of that, the 22,698 people over the age of 90 so far in Phase 1 and Phase 2 of our immunization plan have been immunized, have received their vaccine, either their Pfizer or Moderna vaccine. That a further 28,431 people between the ages of 80 and 89 have received their vaccine. This has happened in long-term care homes and assisted living, in independent living homes, and people receiving long-term home support. And obviously it shows the progress that has been made, progress that will be dramatically increased next week as we begin our immunization clinics for the general population across British Columbia. I want to thank again everyone involved in that process for their work. This morning I'll note that we added, and we're adding information, our weekly report on outbreaks in long-term care, assisted living, and independent living, and note that in long-term care this past week, we've had 12 new test positive cases of residents in long-term care. The overwhelming majority of them, I believe 11, are at the Cottonwoods facility in Kelowna, which we spoke about on Monday. But across, we now have only 6 outbreaks in long-term care, and obviously that report is not as significant as it was some time ago, but it is important to note that that is available for everyone on the BC CDC website. As Dr. Henry has said, 366,791 immunizations have taken place in BC, and that is a significant progress, although we have a long long way to go. I wanted to just bring you up to date very briefly on two programs that are been related to COVID-19, the surgical renewal commitment, which is continuing, of course, since it was relaunched on May 18th. We've completed, health authorities have completed 74,386 surgeries in Fraser Health, 50,469 in Interior Health, 15,446 in Northern Health, 64,829 in Vancouver Coastal Health, and 56,515 in Vancouver Island Health, and 10,930 by the Provincial Health Services Authority. For the week of February 22nd to 28th, health authorities have verified their data, and the total number of surgeries completed was 7,446, and that is 420 more surgeries in the same week last year, 420 more in a time when COVID protocols and the need for safety has put a new challenge in front of our healthcare professionals and our healthcare workers, and I want to thank them for this ongoing effort. I was asked for an update on the programs to support senior services in BC. I note that since July 1st, 2020, the province has hired 1,441 FTEs to support visitation and infection control in long-term care. Of that part of the program, that's 91% of the allocation. Further, the 745 FTEs have now accepted job offers in the HCAP program. So we are making progress on our goal in over the next few years to hire 7,000 net new healthcare workers. So I wanted to just conclude very simply by saying that this is what we know, that 279,782 British Columbians have received their first dose of vaccine. That's 6.51% of us who've received the shot. We know it takes up to 21 days for the first dose to reach maximum effectiveness. We know that while vaccines are not 100% effective, and we see that, we also know that these vaccines that we've had in British Columbia to deal with COVID-19 are some of the most effective vaccines that have really ever been produced. We know that with vaccines, it's tempting to ease off behaviors and actions that stop the spread, to do what we want and not what we must. But the science and the message are clear. They were clear in the modeling presented by Dr. Henry. We must continue to use the skills we've been taught, especially as we modify our routines in adapting to guidelines and public health orders as they evolve. Until we have developed the community immunity we are hopeful for from the vaccine, our journey is simply not over, not close to over. And our task continues to turn the tide against COVID-19 in our neighborhoods, our communities, and our lives. Let's continue on this effort. And let's reflect on this one-year anniversary of the World Health Organization's declaration of the pandemic. Not just on all that we've lost, the lives lost, and the opportunities lost, and all the things that we do together that have been lost, but also on what it shows about British Columbia, how generous we've been with one another, how much each of us has contributed to this effort, and the difference that it has made for people. I, for one, am extraordinarily grateful to everyone watching and everyone else in our province who has stepped up for the ones they've loved and stepped up for the ones they don't know. Thank you, thank you, thank you.